A very good day to everybody. I am Dr. Rahi, Associate Professor from Department of Anatomy, Sree Balaji Medical College and Hospital. Today, I will be discussing about a very important topic in anatomy, general anatomy of the skeletal system. In our day-to-day lives, we would have come across a lot of children or adults with bony deformities. Nowadays, a lot of newer modalities of diagnosis and treatment have emerged to treat these deformities. But knowing the basics of general anatomy of the skeletal system is very, very important in identifying these deformities and treating them. So today we'll be studying about general anatomy of the bone. The learning objectives of today's class are: first, at the end of the class, the students are expected to describe the parts of bone, to know the blood supply of long bone. They should be able to classify the bone. They should be able to describe what is epiphysis and what are the types of epiphysis. They should also be able to describe in detail as to what a sesamoid bone is and what are the types of sesamoid bones. Let's start the class with a small introduction on bones. The skeletal system of a body is made up of bones and cartilages. They are specialized connective tissue. The human body has 206 bones. Functions of the bones. The major function of the bone is to support the body. It also protects the soft organs. It gives movements because the muscles are attached to it. It is also a storehouse of minerals and fats. And it also acts as a site for bone cell formation. So these are all the functions of bones. Coming to the composition of bone. The bone is made up of a cellular component and extracellular components. The cellular component is made up of osteoblasts, osteoclasts, and osteocytes. Osteoblasts are primitive bone cells. They mature to form osteocytes. Osteoclasts are cells which helps in the destruction of bones and in the remodeling of bones. Coming to the extracellular matrix. Extracellular matrix is made up of two components. One is the organic matrix, which are nothing but the collagen fibers which are bound by amorphous polysaccharide substances. This forms the osteoid. In between this, there is something called the inorganic matrix, which is made up of the bone mineral, mainly the calcium hydroxyapatite. Types of bone cells. This is what we already saw. The osteocytes are the actual mature bone cells. Osteoblasts are the bone forming cells, and the osteoclasts are the cells which helps in bone destruction and bone remodeling. Next, going ahead to the gross structure of an adult long bone. If you see an adult long bone, it has a shaft, which is the middle part of the bone, and two ends. The shaft of the bone is covered by something called as a periosteum, which has two layers. The outer layer of the periosteum is called as a fibrous layer, and the inner layer is called the cellular layer. The shaft of the bone has an outer cortex, which is a strong layer of compact bone, and a medullary cavity which is having either yellow or red bone marrow. Coming to the ends of the bones are made up of cancellous bone, which is covered by hyaline cartilage, at the joints. So in this diagram, you can see that the shaft of the bone is made up of compact bone. And in the middle of the shaft, we have a marrow cavity which has either yellow or red bone marrow. Towards the ends, we can see the spongy bone, which is otherwise called the cancellous bone. And the end is covered by a cartilage where the bone articulates with the successive bone. Parts of a young long bone. A typical young long bone has the following parts. The end of the bone is called as the epiphysis. This epiphysis ossifies from a secondary center. Just next to that, there is something called as the epiphyseal plate, which is nothing but the growth plate. Next, coming to the diaphysis. Diaphysis is the elongated part. This is the part which develops from the primary center. So the primary center is nothing but the center at which the ossification develops before birth. Whereas secondary center is a center which develops the site from which the ossification starts after birth. So secondary centers are for the ends of the bones, whereas the primary center is for the development of the diaphysis. Next terminology is metaphysis, which is a junction between the epiphysis and the diaphysis. Now, what is epiphysis? Epiphysis, as we saw in the previous slide, is the end of the bone which ossifies from a secondary center. Epiphysis can be classified as pressure epiphysis, which takes part in the transmission of weight. Example is the head of femur or the lower end of radius. The second type of epiphysis is called the traction epiphysis. Traction epiphysis provides attachment of muscles, example the trochanters of femur or the tubercles of humerus. Okay, these epiphyses are formed because of the traction of the muscle attached to them. The third type is called as the atavistic epiphysis. So atavistic epiphysis has an evolutionary significance. These epiphyses are separate bones in lower animals, but in humans they do not have a separate function, so they join with a near bone which is nearer to them. This is called as an atavistic epiphysis. Example is coracoid process of the scapula. The fourth type of epiphysis is called the aberrant epiphysis. Epiphysis in the head of the first metacarpal or the base of the other metacarpal is an aberrant epiphysis. So aberrant epiphysis is nothing but an epiphysis which is not normal. Coming to the next topic, which is blood supply of a long bone. So this bone that you see in the diagram is a long bone, which means that the length of the bone is much higher, greater than the width of the bone. So this is a long bone. Let's see how this long bone gets its blood supply. One of the major arteries supplying the long bone is the nutrient artery. This nutrient artery supplies the bone marrow and the inner 2/3 of the cortex of the bone. There are a few arteries which are called as metaphyseal artery. These arteries supply the metaphyseal region of the bone. These are otherwise called as the juxtaepiphyseal arteries. The third type of arteries are the epiphyseal arteries, which supply the ends of the bone. Next is the periosteal arteries. Periosteal arteries are the arteries which come along the periosteum or the covering of the bone. They supply the outer 2/3 of the cortex of the shaft of the bone. Next, coming to development of the bone. Bone develops by two types of ossification. Before going into that, what is ossification? Ossification is the process of development of calcium, deposition of calcium and the extracellular matrix and formation of a mature bone. So this ossification can happen in two processes. One is called as intramembranous ossification and the next is called as enchondral ossification. This we can see using a very nice diagram in the next slide. Enchondral ossification, which is the first type of ossification. We'll see how bone is formed by this type of ossification. So during the development of the fetus, what happens is initially there is a group of mesenchymal cells deposited in the area where a bone has to be formed. This mesenchymal cells becomes compact. In these cells, slowly what happens, the cartilage starts getting deposited. This becomes a cartilage model. In this cartilage, at one point, calcium starts depositing and the osteocytes starts getting deposited and bone starts getting formed. This point is called as a primary center of the bone. This is formed in the intrauterine life itself. So from this point, ossification continues towards the periphery of the bone. So this continues towards the periphery of the bone even after birth. So at birth, there will be an epiphyseal growth plate which is cartilaginous and it is constantly getting converted into bone. And this bone keeps increasing in length till the ultimate height is reached. So this type of ossification where there is a mesenchymal cells in which the cartilage is deposited and this gets converted to bone is called as enchondral ossification. The next type of ossification is called the membranous ossification. In this, the same mesenchymal cells are deposited. This is converted into a mesenchymal model in the shape of the bone that needs to be formed. Inside this, directly calcification starts and osteocytes starts getting deposited. So these osteocytes soon mature and become the adult bone. So in this type of ossification, there is no intermediate phase of cartilage. The mesenchymal model or the mesenchymal membrane directly ossifies to bone. This type of ossification happens quickly because there is no intermediate stage of cartilage. So these bones are usually the flat bones which helps in the protection of the various organs in the body. Hence, membranous ossification is a faster process, whereas cartilaginous ossification is a slower process and it is completed only when the person reaches his estimated height. Coming to a classification of bones. Bones can be classified according to the type of ossification. That is what we saw now. Some bones ossify by membrane. That is called as membranous ossification. And some bones ossify by cartilaginous ossification. Example for membranous bones which ossify by membranous ossification are the flat bones in the body, which includes the skull, the scapula, ribs, and the sternum. Example for bones which develop by cartilaginous ossification is all the long bones in the body. For example, femur, tibia, fibula, humerus, etc. Classification based on the position of the bones. Based on the position of the bones can be classified as axial skeleton or appendicular skeleton. Axial skeleton forms the trunk of the body, whereas the appendicular skeleton includes bones that forms the limbs and the girdles which attaches the limbs to the trunk. These constitute the appendicular skeleton. Classification based on the shape of the bones. Based on the shape of the bones can be classified as long bones, short bones, flat bones, irregular bones, pneumatic bones, sesamoid bones, and accessory bones. Long bones are the ones where the length of the bone is much higher than the width of the bone. Short bones are cuboidal shaped bones whose height, width, and the length are almost similar. Flat bones are the bones which are flat in nature, mainly they help in protection. Irregular bones do not have any specific shape. Pneumatic bones, sesamoid bones, and accessory bones I'll be explaining in detail in the coming slides. Example for a long bone is femur or humerus. Example for a short bone or the bones which are cuboidal in shape are the carpal bones and the tarsal bones. Example for flat bone is skull bone, scapula, sternum, etc. Irregular bones are the vertebrae. Coming to the pneumatic bones. Pneumatic bones are bones which have air spaces within them. These air spaces are lined by mucous membrane. So these are bones which are seen in the skull. These includes the frontal bone which has the frontal sinus, maxillary bone which has a maxillary sinus, sphenoid and ethmoid bone which has the sphenoid and ethmoid air sinuses respectively. These bones have specific function. They make the bone lighter. They help to produce the resonance of the sound, and they also helps in conditioning the air before the air reaches the lungs. So these are the pneumatic bones. They are the bones around the nasal cavity in the skull. Accessory bones. Accessory bones or supranumerary bones are bones which are normally not present in the body, but if they are present, they do not cause any abnormality. These are bones which are extra bones in the body. There can be sutural bones, as you can see in this diagram. In between the suture, there can be an extra bone which does not cause any defect. Next, coming to this classification of bone, which is called as a sesamoid bone. The very name represents that this bone looks like a seed or a sesame seed. So this is a very small bone. These bones develop like seeds within the tendon at the sites of friction. Wherever the tendon of a muscle is undergoing friction, there ossification starts happening and a bone is formed. Such bones are called as sesamoid bones. They have a few peculiarities. They develop inside a tendon. They all ossify after birth, after the tendon is put into action. They are devoid of periosteum. And the core of the bones, they do not have a Haversian system. Functions of the sesamoid bone. The sesamoid bone, they resist pressure. They minimize friction. In some places, the sesamoid bones help to alter the direction of pull of the muscles. In some places, they help to maintain the circulation, providing space for blood vessels to pass underneath. These are all the functions of the sesamoid bones. This is a table to show the sesamoid bones in the body. There is a sesamoid bone called patella, which we all know is the kneecap. This is a sesamoid bone which is developed inside the tendon of quadratus femoris muscle of the thigh. The next bone is the pisiform bone. Pisiform bone is one of the carpal bones which develops within the tendon of flexor carpi ulnaris. There is a bone called fibula which develops within the tendon of the lateral head of gastrocnemius, just behind our knee joint. The next is a rider's bone. Rider's bone is a bone which develops within the tendon of the adductor longus, in the proximal end of the tendon of adductor longus muscle. There are two small sesamoid bones beneath the first metatarsal bones also. Coming to the applied anatomy of today's topic, first I would like to talk about something called osteoporosis. So we saw the composition of the bone, which has cells which are called as osteocytes. It has a matrix which is made up of collagen tissue, and it also is made up of minerals. These are the three major constituents of the bone. When one of these constituents are less, this leads to the bone becoming weak. In this defect, which is called as osteoporosis, what happens is there is reduced calcium. The bone mineral density is reduced. Because of this, the bone becomes very weak. It becomes more porous. This leads to easy fracturing of the bones. This is very common in postmenopausal ladies of postmenopausal age group. So in early childhood, there is an age of bone formation. Beyond the age of 20, there is a stage of bone formation and bone destruction which happens parallel to each other. And beyond the age of 40 or 45, there is an age of bone destruction which is slightly more than the bone formation. When this balance is lost, when there is more bone destruction as compared to the bone formation because of the absence of minerals, it leads to something called as osteoporosis. This occurs early in case of women because after menopause, the estrogen is less, which leads to less amount of calcium in the bones, which leads to easy breakage of the bones because of osteoporosis. This is seen in men also, but in much later age. The second applied anatomy that we're going to talk about is the rickets. Rickets is a condition which is caused because of the deficiency of vitamin D and calcium. This leads to poor development of bones, which leads to skeletal deformities. So the bone, when it develops, the bones are weak, and when the children start doing weight bearing, the shape of the bone changes according to the weight bearing. This is called rickets. The same deficiency of vitamin D in adults leads to something called osteomalacia, which also leads to formation of weak porous bones. There is a condition which is called as achondroplasia, otherwise called as dwarfism. There are multiple causes of dwarfism. This is one of those, which is called as achondroplasia. The usual dwarfs who we see in the circus and all that, they come under this category of achondroplasia. So this is because of a genetic defect, which is a defect in this fibroblast growth factor receptor gene, because of which the bone matrix, that is the collagenous part of the bone, is not well developed. This leads to a defect in enchondral ossification of the bone, which means that the long bones are defective in development. They fuse faster before they reach their ultimate height. This early fusion of the bones leads to a short stature. This is called as dwarfism. But the bones which ossify by membranous ossification, they are spared. So they are not much affected. So this leads to short limbs, but there is frontal bossing, there is flat nasal bridge. These are all the features of achondroplasia. But as you can see in this picture here, this is a person with achondroplasia in whom the length of the limbs were increased with surgical intervention, and they have reached quite a significant height. So a lot of treatment modalities have come to treat all these bony defects. So it is very, very important for us to know what is the composition of the bone. So which component of the bone is defective in which type of patient, and based on that the treatment can be altered. Yes, so that brings us to the end of the session. So these are a few important questions that the student should concentrate on while reading this topic. One is classification of bones. Second is epiphysis and the types of epiphysis. Third is blood supply of long bones. And the fourth is the structure of a young long bone or a structure of a growing bone. Today we have studied about the general anatomy of the bone. I am sure you would have understood how important the general anatomy of bone is to know the basis of various bony deformities in the body, what is the cause of it, and how the treatment modality can be done. So today we've studied about the structure of a long bone, the structure of a growing bone. We've seen about the blood supply of the bone. Then we've seen about the classification of the various bones in the body. And then we've seen in detail about the epiphysis and the importance of knowing the epiphysis, and also about in detail about the sesamoid bones. I'm sure it was a useful session, and the clinical importance of knowing the general anatomy of the bone is well understood. Thank you.